Right, that's it going. I was just about to say, whenever I set the video going, somebody comes in, without fail.
Because you took my patient away.
This lady's
Is she numb? Have you checked?
No, I won't. No. Well, actually, it's a very good point. We will check. We'll check the old-fashioned way. This lady's had bunion surgery. She's had a lapidus aching procedure. You can see a nice long wound. We just marked up where the metalwork was for this young lady. She's had an ankle block, so we're going to do an MUA, manipulation under anaesthesia. So you can see she's had a couple of injections to make it nice and numb. Foot's feeling fairly warm now. It feels like it's relatively numb there, Pam. But it's a little bit tight in plantar flexion, so it's not wanting to come down. So when we assessed her in clinic about half an hour ago, post-op, we went, that's really nice and straight, but it's a bit tighter waist. So we want to stretch the bejesus out of that. Any pain there as I put a bit of pressure on it. Excellent. So that's why we call it MUA, manipulation under anaesthesia. We do it under anaesthesia because if we didn't make the foot nice and numb, apart from the fact it would hurt too much, which would not be nice, you would just tense up and splint and we wouldn't be able to stretch it out. So what we do with these is we push up under the metatarsal to kind of lock the metatarsal, and then using the heel of the palm, we push down. Now you can maybe hear and feel that crunching, Pam. Oh dear, and that's me properly putting my body weight behind it. She's about 16 stones and growing. Ooh, okay. So that 2 minutes ago went to there and stopped, will now come down quite a way. So that'll be a little bit sore afterwards, Pam. You'll be numb for about 5-8 hours, maybe a little bit longer. But carry on when you're on the sofa tomorrow watching Jeremy Kyle.
I'm going to work.
You're not? Oh, you're going to work tomorrow? Awesome, okay. When you're having a tea break, just keep working on that, keep working on the stretch down. So push up under the metatarsal, and you want it to kind of be pushing down as well. And that should really loosen up. Sometimes I'll put some cortisone in as well, which will help break down some of the scar tissue, but it's relatively early post-op. Excuse me, so I don't do that immediately. But that's something, if it starts to stiffen up again, and we need to do that again, which occasionally we do, we put some cortisone in. When you're walking, it will get pushed up nicely just through normal gait, so I really want you to concentrate on pushing it down, because nothing ever does. And then the alignment is really nice, because you had a huge bunion before, didn't you? So 2 or 3 times a day, working on that down again.
Okay.
Super. Thanks for the video, Pam.
How long for bending it?
About a month.
Yeah?
Yeah, about a month, 3 or 4 times a day,
Okay.
stretching up and down a waist to really get the range of motion back in that.
Okay.
Alrighty. And we'll see you in the new year.
Fantastic.
Fantastic.